Hi, and welcome to the Miami-Dade Chamber's Member Connection. I'm Eric Knowles, president of the Miami-Dade Chamber of Commerce, and a message from our sponsor.
My name is Amber Longhorn, and I am the Director of Jackson Health Systems Small Business Enterprise Program. Jackson is proud to partner with the Miami-Dade Chamber of Commerce in bringing you this video series. We hope you'll gain valuable information and tools on doing business in Miami-Dade County, but especially with Jackson Health System. We invite you to visit us online for more information at www.jacksonsmallbusiness.org.
So, I'm excited again. It's another Monday, beautiful Monday here in South Florida, sunny South Florida. Thank God today it's been raining for the last few days, but it's still beautiful, sunny South Florida. And today I have a long-standing member of the chamber with us, and Mr. Bill Warren. Bill, how are you?
Well, good morning, Mr. Knowles. How are you today? I'm doing quite well, and I agree with you. I agree with you. We're having good weather today, and life is good.
Yes, it is. Yes, it is. Bill, you've been in business for so many years, benefits and designs, resources, doing what you do. And you work with businesses. Can you explain to the audience what that actually is?
Well, in simple terms, I'm an insurance broker. The name of the insurance company, the insurance agency, is Benefits Design and Resources. And it's an insurance agency, and I'm an independent insurance agent, which means that I'm contracted to work with almost any insurance company that I want to be contracted with. And currently, I am contracted with all the major companies that offer employee benefits in the South Florida market. And I do work with, mainly I work with small and medium-sized businesses who put together insurance plans for their employees. Because many employers today do offer employee benefits. So I work with employers to find the right product, the right mix of both from a cost perspective and a benefit perspective, to help them put into place efficient plans for employees. Because many employees, when they go work for a company, they do have the expectation that the employer is going to offer fringe benefits, employee benefits. So I work mainly with, usually it's the owner or the human resources department, to help to design a plan that meet their needs.
So with that, a lot of small businesses, I guess they would think they don't have the resources to be able to provide a benefit to an employee. So I'm sure there are combinations where you can have the employee participating, or the employer is taking care of all of it. So what's the difference?
Well, by law, to have an employee benefit plan, the employer has to pay at least 50% of the employee only cost. And that's the lowest cost option that an employer offers. I mean, what some companies will do, they can offer 2 or 3 different insurance plans for employees to select from. Now, the employer, by law, they have to pay at least 50% of the employee-only premium. So there is a shared perspective between the employer paying part, the employee paying part. Most employers, though, I find that most employers will pay 75 to 80% of the employee-only cost. And if an employee wants to add their dependents, then they can add their dependents. But many times the employee will have to pick up the total cost for adding those dependents. So, I mean, we try to find a sweet spot between an employer's budget of what they can afford to pay per person, and then do a shared expense between the employee and the employer. But the employer does not normally pick up 100%, even though I do have some clients. I do have some clients who do pay 100% of the employee. And I have clients that pays 100% of employee and dependent. So, that's a great benefit when they do that.
Well, like you say, that's a benefit. So if a new employee is coming into a particular job or opportunity, that could be part of that package that employee would be receiving. versus say a part of that salary may be reduced because you're paying more for their insurance or you're paying their family's insurance. So you're saying that is a benefit that could happen.
Exactly. I mean, many times I think employee benefits rank right up there, probably the second or third highest concern from employees, after employment, as far as, what would attract them to an employer is
Right.
what kind of benefits will they get, especially in today's, with all this going on today, people really don't want to be uninsured. So, I mean, many times when an employee is moving from one company to the next, they want to make sure that if their former employer offered benefits, that, they're going to get benefits or similar benefits to what the former employer had to offer. So it is important to bridge those two for people you're trying to attract over.
What about life insurance and companies paying for an employee's life insurance?
Yeah, I mean, when you talk about fringe benefits, when I said employee benefits, it's not just healthcare insurance, it's a whole package. It can include dental and vision and life insurance, disability insurance, which is very, very important for people to offer. But we can offer an entire package, FSA. I mean, a lot of those acronyms, people probably don't know what they mean, but flexible spending account. And if they have some kind of health savings account, these days people do have high deductible plans and have health savings accounts. But, we try to be creative when coming up with a benefit plan for the employer. And there are things that we can do because no two employers are the same. Every benefit package has to be designed to meet the needs of that particular employer. I can't have a boilerplate option that we can offer to all employers. They all are going to be different. You understand what probably higher on the evaluation is, what is their budget? I mean, how much do they think they can pay towards the insurance? And many times we're looking at not only people that are starting up insurance plans for the first time, but I pick up clients who currently have an employee plan and maybe want to consider moving their plan to another broker like myself, or they're not satisfied with the current broker, and or they want to just explore the market through different brokers and get different perspectives.
Well, you see these commercials on TV, and you see that duck, Aflac. Can you kind of expound on that a little bit?
Those are supplemental plans, which has become very popular these days. There are Aflac has become almost a brand, like Xerox. When people say Xerox, you think of copiers. But Aflac is not the only one that sells supplemental. All insurance companies, a lot of insurance companies are selling supplemental. One that I really like, that I use mostly, is from Allstate, actually. They have a supplemental plan. And those can be great. They supplement the employee plan so that, some of the options would be, if a person goes into the hospital, they pay them X number of dollars per day. They don't have to submit. No matter what the insurance is, separate and apart from the insurance plan. They will pay the person X dollars a day per day when you're in the hospital, or if you're in intensive care, it may pay even a higher amount per day while you are in the hospital. And those can really, really pay off. I had a client recently who they had the Allstate plan, and they do have a high deductible. They have, I think, like a $3,000-4,000 deductible on the plan. And the employee had the prior year, the employee had purchased. And again, this is employee only. This is for employees to purchase outside the employer. So employers don't put money into these. These are optional for employees to purchase. Okay. So we go in, we give a presentation to employees. Some employees select it, others don't. But it gives them an extra sense of security. God forbid if something was to happen that they need to access to healthcare, this can kind of supplement it, because for this particular employee, she had actually forgotten that she had purchased the supplemental plan. And when I went in to do employee meetings, I reminded them of the employee. She's like, oh, wait a minute, I was just in the hospital. I go, well, we need to get this claim. We need to let the insurance company know so you can get reimbursed from your supplemental plan, and she got like $3,000 back from her supplemental plan. So
Wow.
it really helped to offset her deductible and some more out-of-pocket expenses that she had. But yeah, we sell supplemental plans all the time, and you know, it's an individual employee choice. Employers don't normally contribute towards those, but you know, employees do find value in them. And yeah,
I always thought that I didn't have that quite clear, but as you said, those are plans that employees contribute to versus the employer.
yes, they're totally employee options. The employer does not normally contribute to those. It's just that they make it available to them. It's easier for them to purchase. And the good thing about it, if they purchase it and if they leave the place of employment, they can take it with them. They can, I mean, they can't go out and buy it directly, but if they've had the product through an employer plan, they
That's
can
the
keep it
difference.
forever.
So that's the difference. It has to be through an employer. You can't buy it directly yourself, but it has to be purchased through the employer.
Well, there are some plans that you can buy, but they're not quite as good as the ones you can buy through the employer. I can sell supplemental plans. There are supplemental plans that I can sell to individuals, because I probably should say that I not only do I sell employee benefits, but I do a lot of individual insurance as well. I mean, there's a lot of independent contractors who don't work for an employer. So I have quite a large book of business of individual clients who I help them to purchase individual products. And then they may want to buy a supplemental plan, or they may want to buy an individual dental, individual vision. I can help them purchase those plans. It's become you know, after the Affordable Care Act, individual products became a bit more of a challenge to purchase, because you can only purchase most of them during open enrollment, which, by the way, starts November 1st through December the 15th. But I do, in addition to group products, I do individual products as well. And there are supplemental plans that you can buy on an individual basis.
And speaking about open enrollment, let's talk about Medicare and Medicaid. Do you deal with that very much?
You know, I don't deal with those very much. I know enough to help people out a bit, but I do have an alliance with another broker, and he is an expert in Medicare and Medicare supplement plans, and his name is Richard Huberman, and we coordinate, because he doesn't really do employee benefits, and right. I do, and I really don't do a lot of Medicare and Medicare supplement, but he does. So we kind of, you know, we trade off clients on that, but he is very good at it. But I do individuals under 65, right? Individuals under 65 who need an individual policy. I do help them to secure those, either inside or outside of the marketplace.
Right. And obviously in life insurance, there's whole life, there's term insurance, and there's some hybrids in there. You want to talk about that a little bit?
Yeah, you know, life insurance is so vital for people to have, and a lot of people, I know they want to have it, but they keep putting it off, and it's not necessarily a purchase that people really want to talk about, because people don't like to think about life insurance. But yeah, I sell life insurance, whether it's term or permanent. I tell people, especially people with children, with young children because life insurance is basically to replace the loss of income in the event of the unthinkable for the breadwinner, you know. So people with young children should really have life insurance, because your children are dependent on your income for 25 years, maybe, you know, through college, and maybe graduate school. So, and term insurance is the least expensive kind of insurance. I mean, I know least expensive is kind of relative, but compared to permanent insurance, it's a lot less. But what people have to understand is that term insurance is exactly what the phrase says, term. If you buy a term policy for 20 years, at the end of 20 years, it ends. And there's no cash value, there's no cash return, but it does give you protection, excellent protection during those 20 years. Now, normally for a family, you know, I usually sell, for people who got kids, I would normally sell, you know, $1 million, $2 million of term insurance. And again, it depends on your age how much that will cost. Now, to buy $1 million of permanent insurance, you're talking major investment. People normally don't buy that much permanent. Maybe like 150,000. And again, everybody's different. It depends on what your needs are. But people with children, I do strongly encourage them to buy term, because you can buy a lot more of it and it costs you a lot less. And you can buy it for a term of 10 years, 15 years, 20 years. Obviously, the longer the term, the more the cost will be. But compared to the cost of permanent insurance, it's a lot less.
And what about your health? How important is your health in determining the type of insurance you can get?
You mean for medical insurance or for
both?
For both. Okay. Well, the good thing about health insurance is under the Affordable Care Act, Obamacare, whatever you want to call it, doing open enrollment, anybody who want insurance doing open enrollment can get insurance regardless of your health. There is no pre-existing conditions as of today. There's a lot of discussions going on, but I won't go there. But as long as we got the Affordable Care Act or Obamacare, people are guaranteed that you can get, during open enrollment, you are guaranteed that you can get insurance, and there's no questions asked about your health or your medical conditions or your gender. I mean, now male and females pay the same rate. Regardless of the variable is going to be your location, because insurance is based on zip codes. So people in Broward County actually pay less than people in Dade County, and your age. But your prior medical history, as long as you buy it from during an open enrollment period, does not come into play, and everybody can get it. And as of January the 1st, if you have a chronic condition, say diabetes or hypertension, or even something more severe like cancer or whatever, as of you buy it during an open enrollment period, as of January the 1st, everything moving forward from January the 1st is covered. No questions asked. I mean, there are two sides to that coin. The only disadvantage is you can't buy insurance. You can't buy that kind of insurance outside of open enrollment unless you've had a qualifying event. Now, there are situations where you may have worked for an employer and had a qualified plan, but you left that employer. Well, under the law, if you apply for an individual policy within 60 days of leaving that employer, then that's called a qualifying event, and the program will allow you to enter, and you can buy an individual policy.
Okay.
That's guaranteed issue, and that will cover pre-existing conditions.
Right. So, you spoke about Broward and Dade County, even car insurance. We know if you live in Broward, your insurance is not as high as it is in Dade County. We need you to become the insurance Secretary of Insurance with the state, so we could change that.
Well, you know what? I had a conversation with Congresswoman Donna Shalala just last week, and I told her after the election, whatever the outcome it won't be, I would like to have a personal conversation with her. I told her I sell this stuff every day, and I talk to people, and I think I could give a different perspective and helping her to understand, where we need to move to as far as healthcare in this country, and definitely in our county.
Right.
So yeah, it's a lot of moving parts to healthcare. I try to be an advocate, and that's why someone asked me earlier, why I was in corporate America for 20 years before I started my agency, and I really do enjoy being an independent broker because I can offer services. I really enjoy helping people to connect the dots and understanding what to buy. I mean, one of the disadvantages I think of the Affordable Care Act is that it instructed people to go to the marketplace, to that to the website, and try to buy insurance on their own. And I think that's a problem with this system, because many people trying to go and people who are not satisfied with the ACA, I think the biggest problem is they don't know what they're buying. They go out to the website. They don't know most people. You ask them, what's the difference between a deductible, a copay, a co-insurance, an out-of-pocket maximum? I mean, they don't know. And when you're trying to go out and, look at all the plans and make those decisions on your own without consulting an expert or a healthcare professional, I think you make poor buying decisions. And then then after that, in the long run, you're dissatisfied with what you bought, because most people will go out there and they will see the cheapest plan available, and that's what they purchase. But the cheapest plan available may have a $6,000-7,000 deductible, and they don't realize that. They are buying strictly on price. And that same plan that has that very low premium may have very few doctors in the network. Their doctor they've been accustomed to going to may not be in that network, but they don't know how to, do the right research to make sure that the plan that they are purchasing meet their needs. Right. And I think that's one of the main, if there's dissatisfaction with that program, I think it's because people are trying to make those purchases on their own without consulting with the professional.
Well, we really appreciate, what you bring to the table. As you say, you are a professional, always have been a professional, and we appreciate you at the Chamber. So you've been a member of the Chamber for several years. It's important that you be engaged with the Chamber.
Well, I've been a member since 2005, if you want to be exact. But, oh yeah, I've made some great connections at the Chamber. I met I wouldn't know some of the people that I know, or picked up some of the clients that I have, or made some of the connections, whether it's been business for myself, or, another advantage I found of the Chamber is, I like being a resource for my customers. Believe it or not, so many people come to me and ask me, do you know somebody that can do XYZ? And it's to my advantage to have that in my back pocket. They say, well, here's somebody you may want to contact, because of being at the Chamber, meeting people, passing out cards, making connections. So it gives me, it gives me additional credibility with people either I'm trying to do business with or who I'm doing business with when they ask me for a referral, or do I know someone who does whatever that I can, make them a. And if they've come through the Chamber, to me, they've gone through some vetting processes to me, I think, so I don't mind referring them to anyone who asks me for a referral. But yeah, I've been a member for a very long time, and I enjoy the relationship, and also I always enjoy that really, really great gala every year, which I'm gonna miss.
Yeah, well, you're speaking about the gala. Unfortunately, because of COVID, we're not having an in-person gala, but we're actually working on a virtual gala. So be prepared for that. We'll be sending out information very soon. We have a date, which is December 12th. So if anyone wants to get in touch with you, how can they do that?
Well, there's a couple of ways. I think screaming on the bottom here, you can see my phone number is 305-604-8035. That's 305-604-8035. And I would encourage people, if they will take an opportunity to go look at my website. It's very current. It's BDR Insurances. That's with an S. BDR, like Benefits Design Resources, Insurances with an S.com. And it's very it includes a lot of information about the services that I provide. One of the things that I provide to my customers is technology. I have a relationship with a benefit management system called EASE, EASE, and it really offers to small employers some of the technology that normally you'll only get with a large employer, where everything is online and it gets rid of a lot of paper. Employees go out and they complete all their applications and everything on this website, and the employers are able to track, the employee information without having to use a lot of paper. So that's available to all my clients. And also go out and read some of the testimonials and they are very current. I just updated my testimonials in the last couple of months. So read some of my testimonials that some of my existing clients has written about the services that they receive from this agency. So that's the website is BDR, www.bdrinsurances.com.
Well, Bill, we truly appreciate it. If you want to find out more information about the chamber itself, you can go to www.m-dcc.org, or you can call the chamber at 305-751-8648. So this has been Chamber Connection with Mr. Bill Warren with BDR Insurances. Bill, we really appreciate you. And like I said, we'll be getting that information out about the gala very soon.
Okay, thanks for the opportunity to speak to you and to all of your members. I do appreciate it.
We appreciate you, Bill. Thank you. Have a great day.
Thank you.